All right, so always customize, never use off the shelf. Uh, so there is again among the clinical teams this sense that there are some ready-made AI solutions in the market that you could just talk to your procurement team, release a PO, somebody would come and implement the solution, and you can start using AI and benefiting from it. No, I mean, that doesn't happen at all. I mean, you have to really configure because your problems are different. You know, healthcare institutions, the workflows in each healthcare institution are very different. You know, it's very, very institution specific, and one size really fits no one, right? So that is an important thing to keep in mind. And this takes time, right? Because there is already a ready-made solution, and this calls for a lot of work from the clinical teams as well. But it's all time well spent. So this again is an important thing. You should never choose. You should not always choose the cutting edge over the optimal, because simple solutions are more reliable, right? So reliability beats revolutionary every time. You know, when you're starting out, trying to do something, start with the simplest technologies first, and then slowly work your way up to building more advanced features. And what it means is, also in terms of the problems that we're trying to solve, are we really solving the actual problems that people are facing today? They could be simpler problems. Why not focus our energy there instead of chasing like really complicated problems? And this sort of is if you don't remember anything from my talk, I think the most important point that you should remember, which is why I put it at the end, is you should always focus on implementing human-centered AI, right? So we hear a lot about AI, coming in and replacing, humans. Not going to happen anytime soon, right? Because we're the ones who are building it. So why would we let that happen? And the goal should be to kind of augment human capabilities, right? And the best way to do this is we have a heuristic where you take a activity that happens today in healthcare, and then you map out all the different stages that happen in that activity, and within each stage look at what human beings are doing today, what professionals are doing today, and see what you could improve. So the human is still in charge, but then he's doing it with less time, less effort. So that is the way to kind of look at it. So look at the actual problems that people are facing at each stage of the existing workflows. How do you make life easy for those people? And this sort of leads me to talk about the three different streams in which we are considering to invest AI solutions. Like I said, the boring ones, discharge summaries, documentation, billing. If you can actually do these things, like you're saving 40% clinician time, that's 16 hours per week. That's a lot, right, for a doctor. And for an important doctor, 16 hours a week would mean that you would like go talk to more patients or spend more time with patients. The second part is about saving lives. How do you sort of implement AI? Let's say AI. One use case that is often talked about in the media is, can you give an X-ray or a CT scan to an algorithm, and can the algorithm really arrive at a diagnosis which is 90% correct? And then, let's say if a patient has been brought in in the night for an emergency scenario, there's no radiologist on duty. Can AI help you trigger the right emergency treatment protocol? So that is again, like I said, a very important area for us. And also ICU analytics, like a patient is in the ICU, can you take vitals? Can you take other data that is coming from the equipment in the ICU, and build personalized alarms and triggers that could help doctors intervene and save lives. The third one is the more wider area where things are evolving very fast. But this touches upon themes in healthcare that have been around for some time. One of it is how do you monitor patients outside of the hospital system? Is there anything that we could do where when patients are outside the hospital, you can still monitor them, and then one use case is can you have some wearable that is tracking you, and then based on that you could give real-time advice to patients on several things. One use case that we are sort of considering is can you have a wearable that sort of listens to your lung sounds, and it is able to predict or tell you that you're having a wheeze or something, so it's time to get your inhaler dose. or get 2 doses instead of 1, which you usually do. So that's sort of a monitoring and then intervention on a long-term basis outside the health system. And these are ways we measure impact, because every AI project at the end of the day has to defend itself based on how successful it is. And these are all outcome metrics, right? So they talk about patient satisfaction, they talk about efficiency, real gains to hospitals that are using AI. So these are some of the metrics that we are targeting. So we're not really there in some of the areas, but then to start off, to have some target in mind so that it gets the commitment from everybody. And okay, so I mean, if you're from my generation, which is we kind of came of age during the early 2000s, and then Gmail was the school product, right? You got I mean, somebody had to invite you to kind of sign up for Gmail, and Gmail stayed in beta for 5 years, right? So and most people think it's just marketing, but what the lesson to draw from that is, you could still do all that I spoke about and then not have like a really successful product on day one. And then what do? So you remain in perpetual beta for 5 years, and then you keep learning, keep adapting, and keep improving, so that the system is sort of learning with every patient interaction, and you're learning through the challenges that come up with every deployment. So that brings me to the end of my talk.